A doctor is more than a brain that knows facts. A doctor is a person who listens, looks, and thinks about a patient's entire world. For centuries, the clinician's mind has been the most powerful tool in medicine. Today, new machines can help doctors in ways we are only beginning to understand. These tools, powered by artificial intelligence, can also change what it means to be a clinician. They force us to examine the very core of this ancient and trusted profession, challenging our long-held beliefs about expertise and care. Imagine a machine that reads many thousands of medical images, like X-rays or skin scans, in a matter of minutes. It sees small, almost invisible signs that even the most experienced human eye might miss. It gives the right answer, or a very likely possibility, faster than any person could. The machine can learn from millions of past cases. It does not get tired or distracted by a long day. This incredible fact makes us ask a hard but necessary question. Let us look closely at what artificial intelligence does well, because its skills are both powerful and specific. First, AI can process and analyze vast amounts of data at a speed that is simply beyond human capability. It can read every medical journal published on a topic in seconds. It can find subtle patterns across the health records of millions of patients. It can spot tiny differences in medical images that signal the start of a disease. This ability to see the big picture within enormous data sets is one of AI's greatest strengths. It finds the needle in a haystack of information. Second, AI works incredibly fast and without fatigue. A human radiologist might read a few dozen scans in a day, with their focus naturally waning by the end of their shift. An AI can analyze thousands of those same scans in an hour, with the same level of accuracy on the last one as on the first. It does not need a coffee break. It does not feel the stress of a crowded waiting room. This tireless consistency means AI can handle repetitive, high-volume tasks, freeing up human experts to focus on more complex problems that require judgment and intuition. Third, an AI system does not forget what it has learned. Its memory is perfect. It can hold the knowledge from millions of cases and apply that knowledge to each new one it sees. It is not influenced by the last case it saw or a personal bias it might unknowingly hold. This reliability makes AI a strong tool for standardizing care. However, these very strengths also point to AI's weaknesses. Now let us look at what humans do well, those skills that are so difficult to code into a machine. A clinician listens not just to the words a person says, but to the silence between them. They notice the subtle tone of a voice, the flicker of fear in an eye, the deep sigh of relief. They can offer a comforting hand on a shoulder. They can tell a simple story or draw a small diagram that helps a frightened patient understand a complex medical condition. This ability to connect on an emotional level builds the trust that is the foundation of all healing. Doctors and nurses see people as whole individuals, not just as a collection of symptoms or data points. They know that the life a patient lives outside the hospital walls has a profound impact on their health. They ask about family, work, stress. They understand that a treatment plan is useless if the patient cannot afford it or if it does not fit into their daily life. They use judgment when rigid rules or guidelines conflict with a patient's unique needs and values. They practice the art of medicine, not just the science. Human clinicians are capable of navigating profound moral and ethical choices. They can weigh the difficult trade-offs between extending life and preserving quality of life. Consider this first scene, which is already happening in hospitals today. A patient arrives with a persistent cough, a shadow on their lung X-ray. The images are fed into an AI system. Within seconds, the AI analyzes the shadow's size, shape, and texture, comparing it to millions of other images in its database. It flags the shadow as having a 95% probability of being a specific, rare type of cancer. The AI found the right label, the diagnosis. With incredible speed and accuracy, the machine has done its job perfectly. Now the human clinician enters. The doctor reads the AI's report but knows the work has just begun. The patient is afraid, confused, and overwhelmed. The doctor sits down, looks the patient in the eye, and explains the finding in simple, clear words. The doctor then talks about the options, the next steps, and what to expect. More importantly, the doctor listens. They listen to the patient's fears about their family, their job, and the future. And the rise of AI does not erase the clinician. It redefines the role. Some tasks that have long been central to a doctor's identity: memorizing vast amounts of information, identifying patterns in images. The machine will handle much of the heavy lifting of data analysis, routine checks, and initial diagnostic work. This is a significant shift, and it can feel threatening. But it is also an opportunity to elevate the parts of the job that machines can never do. The clinician's role will move away from being a repository of facts toward being a manager of information and a facilitator of healing. Humans will still be the ones who care for people. They will be the ones to navigate the difficult conversations and decide on the hard trade-offs that have no single right answer. They will be the ones who teach patients and families how to live with a chronic illness. They will be the keepers of the sacred trust that patients place in them: empathy, communication, shared humanity. The identity of a clinician is not just the sum of their tasks. So, what is the unique, enduring value of the human practitioner in an age of intelligent machines? The answer is both simple and profound. Humans bring meaning to medicine: context, compassion, care, conscience. They treat the whole person, not just the numbers on a chart, patterns in a scan. They make complex decisions in the messy, uncertain world of real life. They are the keepers of the story behind the disease. It is in that story that true healing begins. In practice, the best path forward is a deep and seamless merger of strengths. We must let AI do the work that requires immense memory, tireless pattern recognition, lightning-fast calculation. In turn, we must let humans do the work that requires deep listening, nuanced judgment, moral courage. Think of the AI as a brilliant, highly specialized assistant. Think of the clinician as the wise, experienced guide,